No.
Are we live?
Yes, we
are
are
live.
Yes, we are. There's 31 people that have joined so far.
You will tell me when I should go ahead.
Yes. Hi, good morning to everybody who's joined this call. This is Itumeleng Mahabane from the Solidarity Fund, and the call really is just a quick update to provide an overview about the fund's activities over the past 6 weeks, provide a sense of the funds that have come in and how those funds have been used. Chairperson of the chairman of the fund, Gloria, will just take you through that. There are 2 short slides that she'll talk you through. And then really we'll just, it's a session to kind of hear any questions or concerns that people have. So we'll have a dialogue at the end of Gloria's address, and I'm going to hand over to her now. Thank you all for joining us this morning, by the way. Sorry, Gloria, one more thing. There is a Q&A function for everybody. So you'll see that you can use that Q&A function to just type up your questions, and so you can start sending your questions even as Gloria is talking, and we'll take them all in groups of 3 or 4 at the end. Gloria, over to you.
Thank you very much, Itu. Good afternoon, and thank you for taking the time to join us this afternoon. It is our first meeting with our funders, and as we promised that we will periodically address you on what we have done with the funds. I'm grateful for the opportunity to share with you the progress that the Solidarity Fund has made in contributing towards South Africa's health and the humanitarian response to the COVID-19 pandemic, and also to provide feedback on the funds donated to us to date and how we have used the money. First, I would like to remind us all of something that we probably all realize. It is true that South Africa responded resolutely very early on, and as a result, we have probably saved thousands of lives. We managed to delay the infection peak, and in so doing, created the space to more effectively prepare the country. The Solidarity Fund has been instrumental in using the time that was brought through the country's initial response well, working with government and organized business, and using your donations, we have ensured that our medical workers and others at the front lines of the health response have the necessary protective equipment to do their jobs effectively and safely. In the 6 weeks since its establishment, the fund has become a fully fledged operation with a credible board, high-functioning board committees, fund administration, as well as external and internal auditors in place. More than 90 voluntary staff across a network of 21 companies and organizations are providing support services to the fund, all on a pro bono basis, with no one earning fees or a salary from the fund. I wish to acknowledge and thank these individuals and companies for their patriotic spirit. During the 6 weeks that we have been in operation, 2 key principles have guided our work: achieving strategic impact and being transparent with donors' funds. The slide on your screens provides a snapshot of monies received and how they have been used. The fund has so far received 2.7 billion rands in commitments, with donations of 2.16 billion rands already deposited by 175,000 South Africans in their individual capacities, as well as more than 1,500 corporates and foundations, both local and international. South Africans donating a proportion of their salaries have thus far generated 20 million rands in contributions, an incredible demonstration of generosity towards their fellow compatriots. We would like to believe that by setting up solid institutional and governance frameworks, we have been able to demonstrate the necessary rigor and professionalism in how the contributions to the fund are deployed. When the Solidarity Fund was formed in late March, South Africa faced a critical shortage of personal protective equipment, which we knew our frontline health workers would need. We had had the benefit of seeing how in other countries, a shortage of PPE meant unprotected healthcare, and frontline workers had paid a heavy price in terms of illness and death. Adding to the complexity was that before the lockdown, 92% of the medical equipment in South Africa, including PPE, was imported and only 8% was locally produced. As we entered the lockdown period, there was hardly any PPE available in South Africa because of supply chain constraints, and this meant that we had to put in place a rapid response to secure the necessary stock. Within 7 days, the fund had approved 100 million rands of funding to procure PPE and made arrangements with the newly formed Business for South Africa's procurement team to begin the process of placing orders. Within a month of the formation of the fund, we approved a total of 905 million rands towards the procurement of PPEs. This has helped secure nearly 80% of the surgical masks and 100% of the N95 masks required to meet the weekly demand for healthcare workers until at least the end of June. In addition, the fund has committed 250 million rands to the National Health Laboratory Services to double testing capacity, enabling them to undertake the mass testing the country needs in order to track the pandemic. Also, in partnership with the Transnet Foundation and National Health Laboratory Service, the Solidarity Fund helped coordinate the conversion of 2 of the foundation's healthcare trains into mobile testing clinics that can take COVID-19 testing to outlying areas in KwaZulu-Natal and the Eastern Cape via our railway system. This initiative will not only help prevent the spread of the virus, but will gather and collate important information and data to feed back to the National Command Center set up to deal with the pandemic. This critical testing intervention comes at a time when we needed it most. It will go a long way in mitigating the development fault lines exposed by COVID-19 and will help the provinces ramp up their massive screening and testing programs, especially in the rural parts of these provinces. As the Solidarity Fund, we are particularly grateful for the spirit and care in which these partnerships with Transnet and the provinces were made. Following the first emergency phase of procurement, we now have the systems and processes in place to procure more critical PPE and equipment from local manufacturers. With more than 6,000 suppliers registered on Business for South Africa's database and platform. As part of its humanitarian relief efforts, the fund has delivered food parcels and vouchers to more than 280,000 vulnerable families across all 9 provinces, surpassing our target of 250,000. This was achieved without increasing the 120 million rands we had allocated to this intervention, meaning we were able to increase the impact by improving on the efficiencies. Feedback from our distributing partners shows that it is a fostering of relationships between communities, NGOs, community-based organizations, and faith-based organizations, as well as local authorities that enabled the distributions to happen effectively. Having reached this first milestone, Solidarity Fund will now pilot a number of more sustainable methods of relief. These include food vouchers and cash systems to reach households that fall outside of the social grant net, or who will still experience severe food insecurity as a result of the continued economic disruption. Within the humanitarian effort, we are now starting to expand our interventions beyond food security as we seek to respond to the ancillary challenges brought about by this pandemic. The following slide provides an overview of our critical assessment and impact analysis. As you will see, the challenge is testing capacity both to help manage infections and enable the economy to open. Outside of that, and within the context of the crisis, we believe that there is a reasonable level of progress and readiness. Clearly, it is not by any means a situation that is entirely controlled, but it is one that is manageable and where we have the capacity to avoid the worst case scenario. One area where you will notice we have a critical gap is on the ventilators. We are working hard on both domestic and international supplies. The fund has approved 11.3 million rands of funding to support the local manufacturing of 2 prototypes of non-invasive ventilators. This project is led by the Department of Trade, Industry and Competition and managed by the South African Radio Astronomy Observatory. The project aims to prepare the way for the manufacture of 10,000 ventilators in South Africa by July of this year, coinciding with the projected peak in coronavirus infections. This is in addition to 200 ventilators which have been ordered at the cost of 19.5 million rands to bolster the national health system's capacity to treat patients suffering from the disease. Following these interventions in the past 6 weeks, we continue to work towards responding to the different phases of this pandemic. From a health perspective, we are entering a period where we believe more targeted interventions to build testing capacity as well as tracking and tracing will be of paramount importance. From a humanitarian relief point of view, we are working with various civil society groups and women's groups to respond to the emerging scourge of gender-based violence. As we have seen with the easing of the lockdown, educational messages creating awareness of the importance of wearing masks, testing, and social distancing as people gradually go back to their daily activities will require our increased attention. The coronavirus has proven to be amongst the most disruptive invasions that the whole world has seen. It has claimed thousands of lives and destabilized communities and economies alike, leaving most vulnerable and unable to provide for their livelihood. As our country faces one of its toughest challenges yet, the Solidarity Fund has represented that beacon of hope, where all of us as South Africans have come together to lend a hand. On behalf of the Solidarity Fund, I wish to express our very sincere gratitude for your continued support and solidarity with our mission of assisting the country's medical and humanitarian efforts in our fight against COVID-19. With that, I would really like my Deputy Chairman to make some few comments as well. Thank you.
Thanks very much, Gloria. And welcome and thank you to all of you for attending. I see lots of familiar names on the list of attendees, so really great to have you all on this call. I don't have a great deal to add. I mean, we can get into the discussion. I mean, I think just to say from my side, that I think that there's been just extraordinary progress in the fund over the kind of 2 months odd that we've been in existence. It certainly kind of exceeded my expectations. I mean, just to appreciate the time and complexity of kind of building a new institution, as Gloria says, the 80 odd people, the many companies that are providing support to the organization, setting up the teams and the capacity. Nomkhita, the CEO who's on this call, has done an extraordinary job at that. And I think all of these, obviously the critical issue at the end of the day is like, what are we actually doing and what are we delivering? And I think, the three major things that Gloria has spoken about in relation to this massive effort around procurement. And I mean, I think all of us, and I'm sure all of you on the call, just appreciate how difficult PPE procurement is in the world that we live in today. I mean, you have 190 countries all trying to buy, the same, equipment from small number of suppliers, as local manufacturing in the various countries kind of gets up and running. And so, it's been a very challenging situation, but, critical to get this procurement in place. The food relief campaign, which to my knowledge is, by far the largest and most comprehensive of all the food relief efforts that has taken place, that, has now been kind of almost entirely executed. The work that's been done in the kind of mass communication, campaign that we've been involved in, I think are all like very significant achievements to date. I think, clearly, these things are not without their challenges, and obviously, one of the big challenges is that, we aren't the health system, and, we aren't the ones who are solving this problem. Our mandate and our intention is to augment and to find the areas for investment that are going to have the maximum possible impact, have the greatest leverage, using this kind of very frictionless, in terms of the kind of low administrative or zero administrative cost kind of rapid response vehicle that has been created. But those have to be very targeted, those kind of interventions and those investments in a kind of much bigger system that is obviously addressing the crisis. But I think that there's been an enormous amount that has happened over the last 2 months, and there's huge credit due to the teams of people in the Solidarity Fund and all of our partners who've been kind of executing on this. Gloria has spoken about some of the things that lie ahead, but I think clearly the challenges ahead are going to, in some respects, be the same, and in some respects be very different from the challenges we've had as the economy begins to reopen. The message is not so much about the importance of staying at home, but the kind of behavioral changes we're going to need. And I think there's sort of emerging consensus on some of the critical things that have to be in place to move the country forward and to be able to contain infections. And we're thinking about what are the best roles that we can play there. But I mean, just to quickly itemize them. Workplace safety is critical, safety on public transport, the mass testing and contact tracing, which, as Gloria says, we've already made a very significant contribution to, but I think remains one of the biggest challenges for the country. The kind of isolation and quarantine centers that are going to be needed for people who are either infected or people who need to be quarantined. And then the kind of behavioral change messaging around the importance of things like social distancing and hygiene and wearing of masks and so on. I mean, those are all vital. And, the big question for us is, where are the big levers for us as the fund? What are the problems that need us? Because obviously we can't solve them all. And we don't want to be directing funds where government or other money is going to go. We don't want to be addressing problems that other people are able or will solve, because then we're not having the kind of impact that, that we seek to have. We want to make sure that when we spend, that impact wouldn't have happened had we not intervened. So, I mean, with that, I think I suggest, Gloria, we open to questions, and we'll just, Tumi, I don't know if you're going to kind of manage that and then just direct them.
Yeah, hi, Adi. Yeah, just to try to kind of maybe keep a flow going, I'll take questions in groups. So far, we don't have a lot of questions. We've got 2 questions on the Q&A. The first question is from Charles, and Charles asks, what is the tax benefit for corporates towards contributions made to the fund? That's question number 1, Gloria. There is also a question from Fabian, who's the principal of Little Rainview Creche. Fabian's question is quite long. He asks, we currently have 33,000 early childhood development creches that are not supported by the Department of Social Development. He explains that they don't meet the, due to the low creche fees, we can't afford to pay our staff UIF or even SARS, because the requirements to get to creche registered on the DSD database need you to follow requirements to get a permit. And that's different from a health certificate. Most creches are situated in low income areas and the maximum creche fee is 300 per child. And you also have to provide your work with a stipend of 800 per month. How can the Solidarity Fund help these creches? Because we had to join creche forums to get support on funds. Our parents stopped paying at the end of March. Monies didn't come to pay teachers and workers. Our greatest concern is after lockdown, some creches might not reopen. I'm going to take a third question. Kirsty Saunders asks, who are the external auditors in place? Is it individuals or is it a company? And I will pause there and take those questions. So just to repeat, Laura, the first question was, what is the tax benefit for corporates in terms of contributions made? There was a question about whether the fund can support early childhood development creches. And the third question is, who are the external auditors? And I'll stop there for now.
Okay, thank you, Itu. I have here the CEO and her team to respond to some of the questions. Maybe the tax benefit, if I can ask Paul to answer that.
Certainly. There is a tax benefit for corporates that do make a donation to the fund, and there is a particular note that we prepared for donors so they can get the advice they need in order to make the donation and get the tax benefit.
Okay. And then, Namkita, can you answer on the external auditors?
Thank you, Gloria. The external auditors that were appointed for the fund on a pro bono basis are PwC.
Thanks. Nicola is here. Nicola, can you deal with the early childhood centers? Yeah.
Sure, Gloria. Thank you, everybody, and good day. I think that the Solidarity Fund is very aware of the difficult time that ECDs, as well as other informal sector businesses, have suffered during this time. And certainly, they have been a primary beneficiary of some of our short-term interventions during the lockdown, for example, in the food distribution program, to be able to ensure that not just the ECDs themselves, but their households that would have been relying on them for food were covered during the month of the lockdown. We do not have, I think, a specific plan or the capacity, I think, as the fund to take on the underwriting and support of the NGO sector or the informal trading sector or educational facilities like ECDs. But I think that we have, as we were involved with the government and other social partners in promoting the COVID grants, I think that there is a strong case to be made for ECDs and informal sector ECDs to be beneficiaries of those new social grants that are COVID related. And I think that we will certainly take that forward as part of our overall response from a humanitarian perspective. But I do not think it would be realistic for the fund to directly fund the NGO sector or the ECD sector directly.
All right,
Thank
thanks,
you.
Nicola. So Gloria, we're getting quite a few questions coming through. Gloria, with your permission, what I'm going to do is cluster the questions into the sorts of themes that they are now appearing in, so we can try to deal with themes at the same time. So I'm going to divide the questions into those that are coming through about the humanitarian and interventions. There's some questions that relate to the fund's governance, essentially. Questions about our health interventions, and then general questions about strategy. So I'm just going to take questions in those sorts of themes. I'm going to group in those sorts of themes. So under nutrition and humanitarian relief, there are a couple of questions that are coming through. The first question I'm going to read is from Colin Coleman. And his question is, please brief us on the food and nutrition interventions. What NGOs are you funding? How many meals are being served? And how much money, what's the budget that's been allocated to food? There is a question from that question doesn't really relate to food. I thought Linda's question related to food, so I'll just add it in there in any event. It's really more of a governance question. Linda asks, there have been some disturbing reports about government relief initiatives being race-based. Please can we be assured that this is not the case with regards to the Solidarity Fund? So it kind of traverses governance and humanitarian. Another governance question is from Dion George, who asks, what are the admin costs of the fund? And is anyone receiving a salary? Right. We have a question that is about broader strategy. It's from Peter Twine, who says, well, firstly, he says, well done on the progress already made. It says, mitigating the unintended consequences effectively requires an even more focused engagement. How are you evaluating the constantly changing landscape? A question that relates to health is, well done on the work being done, as well as to all the volunteers. Will there be more funds allocated to free testing? This seems to be a challenge in locations where residents can't afford such expensive tests. A question from Linda Whitfield, which is around broader strategy and distribution. Can we get some idea on the distribution per province? I'll pause at those questions, Gloria.
Okay.
Would you like, have you got them all? Are you happy?
Yeah, I've got them all. Nomkita and Nicola, can you share most of these humanitarian relief questions?
Sure, Gloria. And I think that I'll also invite Thandeka as well as Nicola in terms of answering those questions. So our food intervention was an investment of 120 million rand. As Gloria said, that was targeted at reaching 250,000 families, vulnerable families, as defined in, I suppose, the Department of Social Development statutes. And this food distribution happened across South Africa, so across all 9 provinces of South Africa. And it was not based on any racial lines. It was really targeting to support vulnerable families. I think all of our funds interventions are really about South Africans across the spectrum, and not based on any bias according race and otherwise. And as Gloria said, I think we had targeted to reach 250,000 families, but we've actually reached 300,000 families. And then in terms of, I think the latter part of the question was about the amount spent per, I suppose, family food parcel. Our budget was at least to cover 400 rand per family for a period of 2 to 4 weeks, depending on the size of the family. And so, Colin, in terms of your question, I don't think that we embarked on almost serving daily meals. This was a once-off kind of intervention from a food security perspective, or trying to step in with the emerging food crisis. We are now starting to migrate towards the use of vouchers and cash transfers, because I think what we witnessed, obviously, during the distribution of food, there was a lot of indignity, I think, in some of the scenes that we saw. I'm sure we all witnessed those. But also, most importantly, I think challenges in maintaining, the social distancing that is required with lockdown. So we are going to be migrating towards more food vouchers and cash transfers. So Gloria, I'm hoping that covers most of the questions that were asked on food.
Yeah. You want to add, Nicola?
Gloria, thank you, Nomkhita. Just the only one extra question that I think Colin had asked was how many organizations we'd worked through and funded in the process. And I can confirm that we worked in a hub and spoke model across the country. So there were 9 implementing agents linked to the DSD, a further 8 group of large NGOs who manage distribution, as well as over 400 CBOs and faith-based organizations were all involved in the last mile distribution project. So this was really a solidarity in many CBOs and NGOs and private sector organizations were leveraged to ensure the solid funds could be distributed in a very short space of time. I mean, to reach effectively, it will be by the end, but households in a space of a couple of weeks required that kind of hub and spoke model. So we will be making the list of organizations we've worked with public, both to acknowledge them and their efforts, as well as part of our transparency process.
Thanks.
I guess the other question that was needing the answer is, can I just confirm again that no salaries are paid? Everything is pro bono at this point. And Jonathan, you can talk about if we're planning to have more money for testing.
Thank you, Gloria, and good afternoon, ladies and gentlemen. Yes, so certainly one of the major focus areas for the fund now is to expand further testing, particularly as we see the national policy pivoting from broad-based community testing to more focused testing around hotspots and outbreaks. We are in the process of approving one grant application for the scale-up of more testing around shopping malls, particularly in very underserved areas where there's been very poor access to testing. So the answer to that is yes. There was also another question I saw about, what about testing for the public who cannot afford testing at the current prices. The model that we're looking at linked to the parking lots of shopping malls will do precisely that. It will use Solidarity Fund funding to provide free tests to people who meet the criteria for testing and can simply walk into one of these testing centers and be tested.
Yeah.
Gloria, so I just want to add to your comment about, in relation to the question about salaries and so on. I mean, it's not only the case that there are no salaries being paid, but there are no expenses of any kind in the fund. Yeah. The only disbursements the fund has made is to direct impact investments in food relief, the disbursements in the health response. I mean, my comment earlier about, I think the fund has created, this very frictionless vehicle, frictionless rapid response vehicle. The frictionless is because there are no expenses, so there's no, in a sense, kind of covering of any expenses. The money that comes in from all of you goes directly to, to impact projects. So I think that's a really important, really important point for us to emphasize. I mean, we've even been exempted by the banks from paying bank charges. That's how far our kind of pro bono support goes from the various corporates that are supporting us.
Yeah.
And
a lot of that support, I think, AD, comes from a lot of the people on this call. So we're very appreciative of that as well.
Okay. There was a question that we haven't dealt with from Linda Brown. She had asked, there have been some disturbing reports about government relief initiatives being race-based. Please can we be assured that this is not the case regarding the Solidarity Fund? So if we can just deal with that question.
I think I tried, Itumeleng, to deal with that as we answered the food question. I think I did emphasize that there's no bias in our interventions. The Solidarity Fund is a fund for South Africans across the needs spectrum.
Okay, great. Thank you for that. I'll move on to the next round of questions. Question in humanitarian and from Bernice Loxton. She asks, are there funds directed towards education, for instance, to deal with the recent vandalism of schools? There is a question from Puseletso Matete, which is a health question. First of all, acknowledging the work done on tracing testing, acknowledging the work on the food parcels and on PPE. But then Puseletso asks, will the fund be looking into assisting with the actual treatment regime, especially as we approach the peak in winter? And Puseletso in particular wants to know whether the treatment regime will be targeted at our most vulnerable groups in society. Just another question on humanitarian. It's from an anonymous person. How is the Solidarity Fund established in terms of helping the most vulnerable in the country with respect to the timely delivery of goods and services? And can we disclose the names of everyone, please? I am assuming this person is asking about our service providers, and that information is available on our website, but Nomkita, you may want to address that later on. There is a question, it's a governance question that is in fact related to the one I just asked. For the sake of transparency, can we get a view on the service providers who are doing all the work with the Solidarity Fund? It would also be good to understand how the sourcing process is managed and who has been involved. So I think those two questions are related. There is a question, there was a question from Coca-Cola, which I fear we have missed, but the question was essentially asking for a sense of our outlook for the future and what our priorities will be going forward. So that question seems to have disappeared. So whoever it was from Coca-Cola, please, if you could post that question again. There's a question from Rogan Davies asking, what is happening with government field hospitals? Do we really have 2,500 beds in place? Gloria, you can decide whether we are the right people to answer that question. And I'm going to take one more question. Hi there. How does the Solidarity Fund manage the costs of PPE equipment and ensure that they are within reason and that people are not paying exorbitant prices? So I will pause at those questions.
Okay. I must deal with the education, just think about the answer there, whether we have any plan to go into education and the vandalization of schools. Jonathan, can you go into that one of the actual treatment regime as we approach the next phases? And Nomkita, you can talk at the service providers. Eddie, should I trust you with the outlook for the future? Yes, and then I think the last one question on the government hospitals and their status. No, we wouldn't have an answer for that. That is for government to answer that. Thanks.
Okay, thanks, Gloria. This is Tandeka Ncube on the humanitarian and about replacing any unfortunate infrastructure that might be destroyed. That is out of our mandate. But not unfortunately, as we all know, humanitarian takes on different meanings when the circumstances are in front of you. But as it is now, that is not our mandate. That would be referred back to the relevant government institutions. Thank you.
Thanks, Tandeka. Thanks. Jonathan?
Thanks. Thank you, Gloria. So there were two questions on the treatment, on payment for treatment. I think our current view would be that in the first instance, the funding of treatment would be the responsibility of government in the public hospital system, and presumably of medical schemes for insured patients in the private hospital system. Of course, if the National Department of Health or provinces do approach the fund for assistance with elements of treatment, we would consider that. I think it's important to understand that the fund's financial resources are very small compared to the Treasury and the public budget. And so anything we could do needs to be, as Adi mentioned earlier, flexible and additional, and filling a gap that the normal public financing mechanisms cannot fulfill. So with that in mind, I think it's unlikely that the fund ends up funding treatment itself. But I think, we would have to look at any particular proposals that did come. Gloria, there's another question was asked about how do we ensure that equipment is purchased cost effectively? This has obviously been a very important issue and concern for the directors of the fund and for all of us working in the fund. And as many of you will know, in the early weeks of this pandemic around the world, there was an enormous demand for PPE from every government and every country. At the same time, a very tight supply, because prior to this epidemic, the vast majority of PPE in the world was made in China. And so there was a period of very significant surges in prices. There were very wide ranges of prices, not only surges in ex-factory prices of the equipment, but also surges in logistics fees. And what we did, working with the BSA procurement team, was to make sure that any order placed fell well within the boundaries of the surge pricing ranges that we could get hold of. We've been seeking price information wherever we can find it. Even that is not very easy to come by. But for all procurements that we did make, we had a range of prices. We try to make sure that the vast majority came in well within those ranges, often towards the lower end, which was generally the case. Once or twice, the fund did make decisions to procure certain PPE right at the top end of the range. And the reason is because there was an extreme urgency for getting that equipment into the country. There was none in the face of a huge gap, and there was sometimes just no alternative. At the moment, we are seeing the prices starting to moderate, and we're also very excited to see the beginnings of local production of certain items of PPE equipment. And the future focus of the fund will be to swing strongly behind support for local manufacturing. The idea being not only can we procure more cheaply, but that when this awful pandemic is behind us, one of the legacies, one of the positive legacies, is a revived local manufacturing industry in this area, which will have very long-term applicability. Thanks, Gloria.
Gloria, can I address the question about the long-term prospects for the fund and so on? I mean, I think
Adi, before you answer that, can I read it again for you properly? Sorry, it came up. So just to give you what the question was, it's from Ian Hirschfield at Coca-Cola, and he says, for planning purposes, what is the vision of the fund going forward as levels of the lockdown change and the virus impact become apparent? Is life of fund in mind? And then Ian just wanted to say, very well done to all. Sorry, I just wanted to give you the full question.
So, I mean, I think this is a very important question, and it's come up a few times, is how we're thinking about ourselves into the future. I mean, obviously, you know, this virus is not a short-term event. This is going to be with us for some time. I think that our understanding from a fund perspective is that our mandate is to address the crisis that has been, you know, precipitated by this virus. So we don't have any intention of creating a long-term permanent institution here. So the question is, you know, what is the kind of useful lifespan of this fund? And I think that's something that we're going to need to work through as the crisis unfolds and as it becomes clear what role there is that we can usefully play. And I think, you know, there's clarity of purpose amongst all of us involved in the fund that, you know, we all have other kind of day jobs, and you know, the focus here is really to, you know, while there is the opportunity for us to have really significant impact, we're all going to be leaning in and making sure that we do that. In relation to the duration, clearly a lot of our spend is kind of front-loaded because, you know, a lot of what we've had to do is kind of immediately respond to the crisis as it unfolded, because as government systems and other systems were getting up and running to respond. So, you know, the PPE is a great example. We kind of stepped in to deal with the short-term crisis, which I think we've really effectively did. I see Charles Searle was on this call as well. I mean, NASPAS have also played, you know, an incredible role in direct procurement to help support the public health system on PPE. But I think, you know, there's been a tremendous amount of work and people that are coming to the country to deal with that short-term crisis. And it was similar with the food relief effort, you know, and emergency short-term intervention was required while the government systems were getting up and running to help deal with food insecurity. And I mean, they're going to be spending 7 or 8 billion rand a month on you know, cash grants to try and address this. So it's kind of finding those, you know, those areas where we can have the biggest impact. But clearly it was front-loaded because of the nature of the crisis, and we're going to have to see as this unfolds, where are the right spaces for us to play and how. But I think it's certainly, you know, going to last the duration of the major part of this crisis. I think our kind of time horizon is a sort of 12-month time horizon. It may well go on beyond that, I don't know. But I think for us, it's very much about, you know, the crisis and the duration of the crisis. I think, you know, one thing that I would like to just add, because I think it is quite important in relation to how you think about the fund, is that I think one of the things that's been really extraordinary about the fund is the kind of clarity of purpose and the sort of single-minded focus of the board. You know, we've got a board that Gloria chairs that has, you know, we have ministers on the board, we have trade unionists from the HAWU, we have you know, someone from civil society at NEDLAC, we have business representatives, and I think there's been an incredible you know, unity of purpose and no dissonance in the board at all about what our mandate is, you know, what we're intended to do, what impact we're trying to have here. And I think that's been really important. And I think the fund has been able to, you know, in a really, you know, this kind of rapid response way to use a proper kind of partnership between, if you think of it, the kind of private sector. The fund has used the private sector infrastructure capacity of Business for South Africa around the procurement. It's linked on the kind of the trust relationships, the deep community knowledge of civil society. Over 400 community-based organizations and faith-based organizations were involved in the food response. It's worked with government on determining the kind of national priorities in both, you know, the health as well as in some of the kind of vulnerable families on the food side. So I think there's a really interesting model about how one gets rapid execution and delivery by sort of leveraging off the best that's offered by, you know, the different kind of sectors of society, but in particular the kind of executing capacity of the private sector and civil society. So I think that's a model that may sustain beyond the lifespan of the fund, but I think that I think we're not in the business of creating a permanent institution here. We're in the business of kind of responding to an immediate crisis.
Thanks for that, Adi.
Meleng,
Gloria, would you like me to? Sure. Yes, go ahead.
Sorry, I just wanted to answer the questions about the service providers, if that's okay at this point.
Yes.
And I think that, as you alluded to, all of this information is on our website. And as Gloria already alluded, that all of the fund's activities is really supported by entities and people who do so on a pro bono basis. So there's actually no fees that are payable, even though there's large, kind of teams that are supporting the fund. So I'll just highlight the major services up to the fund. Old Mutual are the fund administrators. ENS are the legal team. PwC are our external auditors. Sekela Klabiso, our internal auditors. And Chikululu is our social impact reporting partner. So those are the ones that I would highlight at this point. And in terms of how those are sourced, it's really been a process that's overseen by our board, and in particular our audit risk committees, as well as the disbursement committees, based on a particular need, and obviously also the ability to be able to respond on a pro bono basis with the requisite capacity and capability. Thanks, Itumile.
Great, thanks, Nankita. Gloria, there are a few questions that are related to our humanitarian efforts that I'm going to direct. There are two questions that are really related to skills development. I won't read them out in full, but essentially both questions are asking two threads. The first is effectively, do we have a strategy around funding the reskilling of people as people are impacted by COVID-19 and the economy? There's so that's broadly the question. There is a question around, will we direct, the two questions that have to do with sort of farming / food. The first is, will we direct funding to small farmers to increase their production in order to aid food security? And will we direct funding to existing food kitchens in the development of food gardens and to mentor local recipients on growing vertical gardens? There is another question that also links to this question of, will we supply people with seeds for home farming? So the theme around food production as part of the answer to food security there. There are two related questions around whether we would actively support NGOs that are impacted by COVID-19. Would we provide funding to support NGOs who are negatively impacted? There is a question about the sustainability of food packages, but I think Nomkita and Nicola have answered that, and in a way, I think in answering the questions around food production, you will deal with those as well. There is a question which I think will probably go to Nicola. It's from Pomakamoso, who ask, we received 100 food parcels, but we applied for 150. Are we going to receive again? So a few questions around food and humanitarian issues, and also skilling issues. I'll stop at those. You're on mute, Gloria.
Yes, Eddie, can you deal with the active support for NGOs?
So you'd like me to deal with that?
Yes, please.
Okay. So, I mean, in relation to supporting NGOs, I think Nicola kind of mentioned it earlier, but I mean, civil society have been playing a critical role in the implementation of our programs, particularly obviously in the food response. I mentioned the 400, the large, food NGOs, but also the 400 implementing community-based organizations and faith-based organizations. I don't think that it's either in our mandate or in our capacity to deal with the funding crisis in the not-for-profit sector. And so I think our approach is to say, what are the strategic interventions where we can have the biggest impact, and how do we partner with civil society on those interventions to bring the capabilities and the resources and so on that they have. And in that case, there will be funding, as there was in the food program. I see there was a question about gender-based violence, and I think Gloria mentioned in her introduction that this is a very significant humanitarian crisis that's been exacerbated by COVID, that the fund is engaged with, and Tandeka can talk more about that, but is engaged with. And so that will be another instance where clearly there's deep experience, expertise, capacity in civil society around the issue of gender-based violence. So it's in these kind of strategic areas that we'll work with the not-for-profit sector. But the problem of funding in the NGO sector, even funding for COVID-related issues, is just vast. I mean, it's way beyond the capacity of the Solidarity Fund to be able to handle that, even to be able to deal with the thousands of funding requests and how we would go about processing them. So we have to continue, I think, to apply our kind of focus of where are the big strategic interventions where we can have the most impact that are really additional in terms of the impact wouldn't happen had we not funded them, and then how do we partner with organizations in civil society to help achieve the goals that we've set.
Unmute, Gloria.
I think on the question of funding and reskilling people, it probably links to what Tandeka said before. It is not in our mandate as we speak. So we can safely say not quite there. Then on this one about the small farmers and food gardens and seeds, while we're dealing with the food security, we are grappling with how do we have a sustainable food security solutions. We don't quite have that answer yet. So I would say no, we're not funding small farmers or for food gardens. We're not supplying people with seeds. We are, however, trying to find a solution for how do we make food security a sustainable solution as opposed to just food parcels. I hope I've answered that question. Did I leave anything, Itu? I think these ones are all answered.
Yes, this round of questions has been answered.
Yes.
We've got a number of questions, but we are almost out of time. So I'd like your guidance. What I'd like to propose, but it's up to you to suggest that we'll take a last round of questions, because I know that quite a few of the speakers are going to have to go. And what we could do is then take all the unanswered questions and make them available as a Q&A on our website. So with your, I'll take your guidance, but we could commit to answering all the questions that we're not able to deal with and posting them on our website. But let me take your guidance on that.
I think let's try to answer the last questions and then the balance we put on the website.
Oh, okay, great. So let me go there. The question on gender violence is take. So there's a question from Freddie Ligeti. What does the fund think about sharing notes with short-term insurers to guard against unfair enrichment? That's a governance question, I guess, to think about. There's a question that says that how is the fund ensuring that politicians are kept out of that? How are we ensuring that there's no political interference causing malicious intent in our disbursement activities? There's a related question that says how we are ensuring funds are used compliant and valid. So how is the Solidarity Fund ensuring funds are used for compliant and valid PPE, as there is a concern about consumer health and different specification requirements? So that's an assurance question around our PPE procurement. There's a question from Dennis Delport asking to confirm the donations received and the amount being given out. You can, I mean, that's obviously on our website, but you can choose whether you want to address that immediately, Gloria. And I think we'll stop at those. That covers the bulk of them. And then any other questions after this round. We are going to pull all the questions that you posted, and we will make sure that there is a Q&A to all of these on the website. Gloria?
Okay, I would ask Jonathan to deal with the assurance question. If I understand it, it's the assurance on the equipment itself, right?
That's correct. I think,
Yeah.
unfortunately, we may not have
I think we have
Jonathan.
lost Jonathan, but I'm happy to help him with that question, Itumeleng.
Okay. All
Okay.
right. Go ahead, Nomkita.
So on the assurance question, in terms of the demand statement, in terms of the type of PPE that is required, and also what are the specifications, there's quite a precise model that is influenced by the National Department of Health alongside their advisors, which are CHAI, that determine the type of PPEs that inform our decisions in terms of how we disperse. So that's the first kind of process in that value chain. And in terms of the specifications, there's quite clear guidelines from the World Health Organization in terms of the standard that the PPE has actually got to meet. And then as part of the procurement process, both from at factory level, there's a quality assurance process that actually needs to happen with a respective certification that is required before the particular products are actually released from factories. And once the products also arrive here in South Africa, there is also, once again, at the distribution centers, a quality assurance process that is run by the South African Bureau of Standards to ensure the right quality assurance and with ensuring that there's a matching quality assurance certificate per items that are purchased. So that's quite a detailed and intricate process, particularly because we want to ensure that we are paying for the right quality and that also we are protecting the front line accordingly.
Okay. And I think on the political interference, I can confirm that at this point we have not experienced any political interference that is negative. And we work side by side with the government and business. However, we're very independent, and but we work quite closely with both of them because we need both of them as partners. But we're an independent fund.
We have reached pretty much the end of our questions, Gloria. So if you're comfortable, I'm going to hand over to you to close. I'd just like to say there have been quite a few comments just appreciating the team's dedication, and just to remind you that a lot of the comments that we had, which I didn't pass to you, were really comments congratulating the team and expressing happiness with the team's work.
Thank you, Itu. I cannot express enough how just grateful we are for the support that we have had from South Africans and abroad for this complicated program. We really appreciate that. And we have promised that we will, in the spirit of good governance and transparency, we will be open to actually have frequent sessions with the funders. I hope you have found it quite useful. At least for us, we have, just by your questions. And I just want to say thank you very much. We really appreciate it.
Thank you.
Great, thanks. That ends this webinar. And thank you all until the next one.
Thank you.